welcome back to our Unclenched podcast. Today's a special podcast, and we're going to do another question and answer session from all the questions that you all have sent in to us. But before we get started with that, we've got to get caught up, and there's my pretty Priya. What is going on with you? How's life treating you? How's everything going?
Life is good and very, very busy. My son just got his tonsils out, his adenoids out, and his tongue tie cut just last week, about a week and a day ago.
Wow.
And I know. So the recovery has not been easy. Like, I don't care what anyone says, this ain't an easy recovery. But one thing we did notice right away, Alex, which I thought was pretty cool, was he like the day that he got the tongue tie cut, the day he got everything done, he was more easily able to say R and L sounds immediately. So my daughter's name is Serena, and he would always say Sawina. And now he can actually pronounce the R, and he can say words like level really easily, where it was really hard.
Does he notice that?
Does he notice that?
Yeah.
So I said say R, and he started saying R, and he said, "Oh, that's easier." So I don't think he knows why, but he just knows that he can say things more easily.
Right. Well, that's great. That's great.
Yeah. What's going on with you?
Well, my oldest daughter, who lives in New York City, has to find a new apartment.
Oh.
So she's been in the same apartment, which is kind of unheard of, for 8 years in New York City. And typically people move and jump from apartment to apartment. And it's weird because in New York, you only can look for an apartment a month before you are moving in. So it's not like you go up in the spring and you sign a lease for June or whatever. You have like 30 days because they just get gobbled up so quickly. Wow. So my husband and I this month are going to go up and help her because the end of March she'd like to be out. So we got to go up to the end of February, which is fine. I love New York. So that's what's new here, and pretty much nothing else. And we're just hanging out and enjoying the cold winter as we speak.
Have you gotten snow?
We got some snow, but I tell you, last week it was like in the single digits, and it was awful. The weather was awful. But it's another week closer to spring. That's how I look at it.
Oh yeah, definitely. I think we're due for some snow next week. So
yeah. So listen, let's get started for our with our questions. Okay, I'll pick one. You pick one. We got a whole list. Hopefully, we don't trample on each other's question and repeat. But first question is, I currently wear an orthotic, but was told to only wear it at night. No mention of a step 2. Go ahead. You hit it, Priya, because I know that's familiar.
So first and foremost, a lot of people will confuse the terminology. Night guard, orthotic, splint. A true TMJ orthotic, in my opinion, is made where the muscles are put in their neutral position, their correct resting length, and the joints are decompressed and aligned. So I don't know what kind of orthotic this viewer has who asked the question. But for me, I have my patients wear the orthotics 24/7 at the beginning. So 22 hours a day, 7 days a week, and they only take it out when they eat or drink. The reason I have them take it out when they eat or drink is it really lowers the chance of the bite changing, because every time you chew, you reset the bite. So I don't want the bite to change. I want to minimize that risk as much as possible. And it's not always possible. But the reason is because once the bite changes, we're committed to having to do phase 2 treatment, which is getting the teeth back together in the position where the muscles and joints are stable. Getting the teeth back together requires usually full mouth reconstruction or orthodontia, braces, to get the bite back to meeting again, right? And so I'm not trained in phase 2. And I don't want to refer anyone out for phase 2. I feel really uncomfortable doing that because it's out of my control how the phase 2 is done. And I don't want my patients to end up in a worse position than they were before. So that's how I do it. And again, I don't want to speak directly to the viewer in that, this is how your dentist should do it, because I don't know what they made you.
Right. And I agree with you. We don't know what other dentists do or how they're trained. All we can speak on is how we are trained. Mm-hmm. I agree with Priya about when you're using a removable orthotic. And I use both. I use the removable, but I do it differently than Priya, and I have them wear it for 24/7 for a few months. Then, if they want to wean off, we try it. I find a lot of my high pain patients can't wean off. They're like, I don't feel comfortable chewing in it.
Mhm.
My headaches are coming back, or things tighten up a little bit, and that can happen. And if that's the case, I'm like, well, then you've got to wear your orthotic, and you
Mhm.
have to think of phase two. In
Right.
my office, I can treat phase two because I'm a lot older than Priya, let's face it, and I've trained a little bit longer. And I figured that all out. But in the beginning too, I was just using an orthotic and going from there. But I've had Priya patients come into my office that have been using some type of appliance. I don't know if it's a night guard, if it's a splint, whatever you want to call it, and their bites have changed. I have a case like that now,
Mhm.
and I have to raise her teeth in order to have some occlusion now.
Yes.
So, and I see that quite a bit. So you're right in saying that you don't want to change the bite, because when you do change the bite, and if your patients are amenable to, comfort wise being with that bite, then I definitely would say then that's the way to go. And that dentist may not have told you about phase two because they don't know what to do for phase two.
Right.
So, you know, that's who knows. I don't know.
Yeah, exactly.
So,
I don't know either. Um, so yeah, let's go to the next question. My vision is awful. Can this be from TMJ issues? Do you want to start, Alex?
okay, I will start with that. So, your vision's awful. Could it be with TMJ issues? I have had people's vision change and heal with tensing alone because it's relaxing the muscles in the area. Now, one other thing is too is your sphenoid bone, which is the roof of your mouth, but also your brain sits inside that sphenoid bone. Your ophthalmic artery and nerves go through that sphenoid. So if you've had a history of concussions, that's what I see a lot with the vision change. And the concussion could have been 10, 20 years ago, but people will say, oh, I used to play football, or I was a gymnast or something like that and fell on my head a bit. And if that sphenoid bone gets compressed, you might need an adjustment of that sphenoid bone to get the blood to flow and the nerves that control the muscles of the eye work better. So it
Sure.
could be, but we don't want everything to be like, oh, it's TMJ.
I know.
Oh,
Yeah,
my
you have
big
to be
toe
careful.
hurts, it's TMJ.
Yeah.
So you got to be careful about that. But is there a possibility? I think, yeah. What do
Yeah.
you think, Priya?
Yeah, and there is a possibility, and I've seen it before, where blurry vision has completely gone away with my treatment, and I've seen it where blurry vision hasn't been affected at all by my treatment. So
Right,
again, the cause could not. It doesn't have to be TMD, right? We have to keep our
right.
minds open. But another thing to keep in mind, like the arteries, the blood vessels, the nerves, that what you were mentioning, Dr. Alex, of course, they run through the sphenoid bone, but also the muscles. There are muscles that attach to the sphenoid bone, the lateral pterygoid, the
They're
medial
good in the
pterygoid,
medial. Right,
and these muscles, yeah, are key players in clenching and grinding activity. And when those muscles are too tight or constricted, they actually shorten. Muscles shorten when they're really, really tight, right?
hmm
So if
hmm
you imagine a muscle shortening, it's going to yank on that bone a little bit where it attaches. And that sphenoid bone makes up part of the orbit of the eye, right? So
right.
if you're yanking on these different structures, it can affect your vision, yeah. But are all vision problems when you have TMD related to TMD? Not necessarily.
No, right, right. Oh, right. Next question. I went to my TMJ dentist, wore an orthotic, and now my bite is even more out of line than before. Is there any way to fix my bite and return it since my orthotic created space?
Oh,
That's kind of like what we just talked about.
totally.
And what I don't think there's a way to get your teeth to come together the same way. But if you're wearing your orthotic because you feel good and you're out of pain, continue to wear it. But then you're the person that needs to think of phase two. And we want to get your teeth to touch in a couple ways. One can be orthodontics, one can be full or partial mouth reconstruction to get the teeth to touch. So that might mean crowns on the bottom or crowns on the top and the bottom, and it can come out beautifully, but you got to make sure you go to someone that knows how to manage your bite and how to translate all of the data into a good bite. And then
Mhm.
you don't have to wear anything at night. That's the joy of getting restored.
Yes, and that is the thing I really want for my practice. Like, for someone to be able to do phase two. So I'm actually onboarding a dentist. I'm getting an associate, I think, this year. Fingers crossed if all works
Yay.
out. And he's well versed in neuromuscular dentistry, and
Uh-huh.
he's also done a lot of full mouth reconstructions. So
Yeah,
he would be like my phase two guy. My husband's getting trained, and then also one of us needs to get trained in the ortho aspect of it.
sure,
So
sure.
yeah, I think that if your bite is off, it's because your muscles and joints have adapted to this new position that's better for them. But then finding someone who can bring your bite together in a way that still respects the muscles joints is key, and that can be
Right,
hard. It can be hard to find someone, but
right,
so yeah,
right.
let's see. Is it normal to feel bottom tooth discomfort after wearing a sleep orthotic?
Okay, so here we're getting into what it is, and I don't know what you mean by sleep orthotic, but we're just going to say appliance, okay? So when you're wearing an appliance just to sleep in, I have had patients say my it feels tight in the
Mhm.
front. And a lot of times that's because the mandible can flex and you can't get that flexure in something that's rigid over your teeth. Sometimes the teeth feel tight because when you sleep, I'm thinking it's a lower one. That orthotic or sleep appliance is bringing you a little bit forward, and you're kind of pushing against those front teeth, so that can make them tender. Usually, teeth become tender because of some kind of force. So it might be the rigidity of the orthotic, or it can be the movement of the tongue, even pushing on that orthotic to move those teeth, or it can be the way the orthotic hits the top teeth. What do you think, Priya? Did I miss
Totally
anything?
agreed. Yeah, like it's usually, in my experience, it's usually that it's too tight if it's a bottom orthotic, or if it's a top orthotic. Like I make an ARA style, so it's an upper appliance that fits on all the teeth, and it has this flange that comes down,
Hmm.
and you rest your bottom teeth in front of that flange, holding your jaw in a specific position. So when the bottom teeth are hitting against that flange a little too aggressively, I usually just have to adjust that. Flange is such a weird
Hmm.
word, and I've said it like four times
Yeah.
now, but I usually just have to adjust that flange down, and then that pressure goes away on those bottom teeth. So it's usually something in the fit of it or how it's contacting. Yeah.
Hitting. Yeah. Yeah. Oh, right. This is a question. What do we do if we can't see you?
Ah,
Well, we both have a lot of patients that manage to see us
they
somehow, and
travel.
yeah, they
Yeah.
travel. But if you can't see us and you want somebody to be kind of taught like we are, what I would say is to go to the ICMO website, look up doctors that are in your area, possibly closer, an hour away, 2 hours away, something like that, and make an appointment there. That's the only thing, because unfortunately, we can't treat people, without seeing them. We got to be hands on.
Yeah, I agree. I mean, many people travel and they find a way to come see me, but if that's just not even possible, I have a list of like four dentists that I frequently refer to. I don't like to refer to more than that because I don't these four that I refer to have had people go to them and come back with really good experiences. I've
Yeah.
referred to other people outside of that four and it hasn't gone so well. So if you go to the ICMO website and you look for somebody, I would also look up my video on YouTube, like questions to ask your TMJ dentist, because it's very specific questions and you'll get an idea of how much experience they have. Because not everybody
Mhm.
on the ICMO website has the same level of experience with treating TMJ.
Exactly.
So I want to throw that in there with a bit of a caveat because I did refer to someone on the ICMO website once, and that patient came back to me and like yelled at me and was like, he was horrible. I'll tell you more about it later, Alex. You'll get the details. Why would you even send anyone there? I trusted you. You shouldn't have done that. So now I'm super careful. And that's literally why I made that video. Questions to ask your TMJ dentist so you get an idea for how much experience they have.
Yes. Agreed.
Yeah.
Agreed.
Yeah, I got in big trouble and I was like, oh, okay. So let's move on to the next question. I like this one. Any advice on correcting a wonky jaw? Will acupuncture help? Night guard made it worse as I was chewing all night. My consultant recommended that I meditate more. So I don't think meditating is going to fix a wonky jaw, but I'm going to let you lead with this one.
Okay. So that's kind of funny. I think with a wonky jaw, you got to look at the hard bone. You've got to look at the positioning. You've got to look at the muscles, and then you've got to make a guard accordingly. A night guard can be very bad for you. Not our guards are made the same. We
Mhm,
preach this all the time.
mhm.
And a bad night guard can be worse for you, and you can end up with issues like this. I've had people lock their jaw because they were chewing on a bad night guard at night, or what have you. But when you have something that's not in equilibrium with your body and your muscles aren't happy, your body's response is to get rid of it. How does it get rid of it? It will clench it, it will grind it, or it will spit it out.
Mhm.
So that's how you got to treat it the proper way. According to me, in my opinion, the proper way is to look at the jaw, the teeth, the muscles, the airway all together.
Yeah. Yeah, I totally agree. And, there's a night guard just isn't appropriate to treat sometimes even mild TMJ issues, and it can make them a lot worse. It's definitely not appropriate to treat moderate or severe. So, um, again, I hate to keep plugging my YouTube channel. That's not what I'm trying to do, but there's a video called Over the Counter Night Guard. So I think it's called OTC Night Guard versus night, dental night guard versus TMJ orthotic. And it goes
Mhm.
over how all three of those are different, what the differences are, how one is going to help you and the others aren't. So just, being, it sucks for you viewers because, or TMJ sufferers, because you guys really have to educate yourselves because even as dentists, we're not super educated on this. And so I think that, getting educated on that and figuring, once you kind of go down the rabbit hole, you'll figure out why a night guard isn't helping you. So I think
Right.
you know, fixing a wonky jaw, it's such a broad question.
Yeah.
But it could be a TMJ orthotic and phase two treatment. It could just be the orthotic.
It could be T scan.
It could be T-scan, disclusion time reduction therapy. So there's
Right.
different ways to fix a wonky jaw, but I hope that helped answer your question somewhat.
Right. One thing I want to say about night guards, a while back, I was involved in a study at Boston University and also a study at Ohio State University, and we
Mhm.
fitted their um, athletes with mouth guards that were made neuromuscularly with the K7, Tensingham, and all that stuff. And the studies, hands down, showed with the right sports guard in, you could lift more. You had more range of motion with your
Oh,
neck. You had more flexibility. Your peripheral vision was better because you can turn your neck more. So it was just totally amazing and eye opening. And once I did that, I came back and then I had like people from the Penguins and Steelers and a couple other athletes call me to make me these guards. One patient who used to play for the NHL and he was a good defenseman. And if you're a Pittsburgh fan, you can look him up. But he got a concussion on the ice and he said, Alex, I was out for one game. I know that guard helped me. So it
wow.
was crazy. And if you would go back and see his hit on the ice, you're like, oh my God, that was a bad hit. But he's like, I cannot play without that mouth guard.
Amazing.
So a good mouth guard is so much better than just a generic because a lot of times, most of the times when a dentist makes a mouth guard, what they do is they take an impression of your top teeth, they take, or a night guard, they take an impression of your bottom teeth. They go with their hands, not your muscles, with their hands, put them together, get a sheet of plastic, melt it over the bottom or melt it over the
Yeah.
top, and then here's your mouth guard.
Yeah.
Now, what kind of balance is that giving us? Not good balance.
Yeah. Not good balance. And I have patients too that wear their orthotic to the gym frequently, and they're like, "It makes my workouts better. I love this thing."
Right.
A lot of people
You
drive with
breathe
it.
better. Yep.
Mhm,
Opens up the airway.
mhm.
It's amazing. It's amazing.
Truly,
So
yeah.
here's a question. Is off balance sensation a normal TMJ symptom? How can you treat or help alleviate that sensation?
Oh
I
yeah.
get that a lot. How about you,
Oh
Priya?
yeah, off balance I get a lot, and the best treatment for that is either T-scan, disclusion time reduction therapy, or the orthotic. Again,
Right.
and those are the two primary methods that I treat that with. And again, if it's caused by TMD, because dizziness or off balance can be caused by other things, but if it came on at the same time as all your other TMD symptoms, it's likely related, right?
Hmm.
Can't say with
Hmm.
100% surety, but I see that go down fairly fast if it's TMD related with the
Oh,
treatment.
I do too. I've had patients that couldn't walk down the hall unassisted, or their hand is on the wall the whole time they're walking down the hall.
Hmm.
So, and then when that goes away, they can't drive because of it. But it all comes to the balance. All starts from the top down. Not all the time. Sometimes it can be from the feet up if you have a structurally shorter leg, but those are only 20% of the time. 80% of the time, it starts with the top block. And sometimes we can't fix it alone. We may need an AO chiropractor to help us out, or a physical therapist to help us out, or cranial sacral therapist to help us out. But, I always tell my patients, let me get started first, see how much we can change. We need a little bit more help. Then we call in these other modalities.
Yeah, yeah, totally.
Okay. Let's see. One said, where can we find a provider near us? We already answered that. Go to the ICMO website. But then Priya has the YouTube that says, what questions to ask,
Mhm.
and how do we find one? And make sure they do this. Priya and I, this is all we see in our office all day long.
Oh
Eight
yeah.
to five, it's TMD, it's pain, and that's all we see. A lot of people will say we see a couple a month, or that's not maybe the one you want to go to.
Yeah. And if you really can't find anybody in your area, don't completely close your mind to traveling if you can do that. Because many people do travel to see both of us, right, Alex? And
Oh
I
my
mean, we
God.
have someone coming from the UK in a few weeks.
Yeah.
I have people
Yeah.
coming from all over the world. And again, I know it's not possible for everyone, but some people just dismiss it immediately, even if it is possible
Right.
financially or time wise, right? So if that
Right.
is possible, I would say don't dismiss it because this is your quality of life from it.
Right. And
Yeah,
you
the
can't put a
Dodgers.
price tag on that.
Exactly.
You really
Exactly.
can't. Yeah.
So I was going to go to another question since we've got
Sure.
some
Go
time
ahead.
left. There is a doctor on TikTok, love TikTok, stating we have to have some kind of obstruction in our airway, and it's not, in fact, stress causing clenching. Please, please tell me he's wrong.
Well, it can be both, because when you're clenching, sometimes you're moving your jaw to move forward or grinding to move forward to open your airway. So that, I think it kind of can be that, but I think what the stress causing the clenching, stress causing the clench. Yeah. I think it can be. I don't think that's the only thing though. What about you, Priya?
Yeah, what's interesting is as I've done more and more T scan and disclusion time reduction therapy, and if you don't know what any of those words are, just type them into YouTube and there'll be videos. I made one, Dr. Ben Sutter has made a bunch. Um, but as I've done that more and more, I found that people have stopped clenching. And it's
Yeah.
so interesting. So, one of the reasons that you may clench too is that your bite is off and you're constantly trying to find the right bite. Like your brain intuitively knows
Right.
it's off. So, you keep shifting and clenching and grinding and trying to find that correct bite that puts the muscles in a
At
happier
rest.
place. Yeah, and
Mhm.
that decompresses
Mhm.
the joints. And so I've noticed I had a patient text me and she says, I don't clench at all during the day anymore after getting T scan. She's like, it's amazing. Like I couldn't even control it before. Nighttime, I don't know. But I had it done on myself, Alex. And
Mhm.
Dr. Sutter did my DTR at the end of December, and I'm not clenching at night anymore.
Right. And you know what I found too, when I look at my DTR and the scans, if a patient comes in and that's the last thing, well, my clench is down, because I always ask them to rate it. And when they say the clench is down, but it's still there, if you look on those scans and you still see high in the posterior,
Yeah.
God, nail it. You
Nail. Yeah.
just take those away and then their clench is gone.
Boom.
I
Yep.
do the same thing because I use the DTR on all of my orthotics, and my fixed ones and my removable, and it kind of brings the adjustment time down a bit.
Yeah. Yeah,
Mhm.
definitely. So yeah, I mean, I think all of those are reasons. Is the bite, sleep apnea and obstructed airway, stress. There's so many different reasons that we clench and grind our teeth. Even sometimes just stability and bringing like stability to the body if something's off. I feel like making sure that the mandible is in contact with the maxilla and therefore the neck makes you
Mhm.
feel more stable if something's off with the
Mhm.
neck or something's
Mhm.
off with the shoulders. And so I think there's so many different reasons for clenching. It's just kind of honing in on why you are doing it.
Right. 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 Right.
Yeah.
Okay. Next question. I'm having pain only on the left side, not both. First, they say TMJ. Now they say
Good question.
trigeminal neuralgia since it's only on one side. Can TMJ be mistaken for trigeminal neuralgia? How do you rule out one or the other?
Sorry, can I
That's a
take
good
this? I'm like,
question.
I can't contain myself.
Go ahead, go.
Yeah.
Take
Yeah.
it away.
I have to go. So one sided or both sided, that doesn't mean anything. It could still be
Anything.
either, yeah, TMD or TN. So right off the bat, don't believe that, I guess.
Right.
Um, Now, TMD and TN can have very overlapping symptoms, and it can be very hard to diagnose or distinguish between the two. But some people will even go as far as to say that for many people with TN, not everybody, but for many people with trigeminal neuralgia, it's just heightened TMD. So if you can bring down the I guess the threshold of excitation of the trigeminal nerve, and if you could calm down the muscles, those symptoms can still go down. And so if you treat
Mhm.
TN like it's TMD, you can still help many patients. So it's
Mhm.
very interesting um, to distinguish between the two. And I even, again, I'm plugging my YouTube channel. I'm not trying to do that, but I did make a video called Trigeminal Neuralgia or Temporomandibular Disorder. And that video really highlights everything that I'm saying. And I did get a lot of pushback when I posted that because TN sufferers were like, my joints don't even make noise. And I'm like, your joints
You
don't have to
don't
click or
need to
pop
make
for
noise.
you to have
Right.
TMD or TN,
Right.
right? It's
Right.
muscles and nerves.
Right. Right. So I think the same way. In fact, I had a woman in my office the other day from Ohio. I'm in Pennsylvania, and she's about 78, I'd say. And she came in and she said for 10 years she's been suffering from trigeminal neuralgia. And I'm like, really? So tell me about it. So we talk about it, and it's on both sides of her face. And I'm like, that's interesting.
Hmm.
It's on both sides of your face because typically that is one sided. Both areas of where the trigeminal nerve comes out. Typically, maybe it has happened, isn't going to be that. I'm like, oh, okay. Tell me more. So she's been dealing it for 10 years, has been to Cleveland Clinic, has been everywhere, and nobody can do anything. And they want to do some sort of operation on her. And I'm like, on both sides? She
Holy
said,
crap.
yeah, it didn't sound right to me. And I'm like, yeah, I kind of don't agree with that either. But through our therapy, I just saw her on Wednesday, so 2 days ago. And after about maybe 3 weeks or so, I put an orthotic in, did some laser, did some muscle movement, and all of that kind of stuff. Sent her also to a physical therapy.
Mhm.
And her pain level was an 8 out of 10 when she came to see me. Now it's
Yes.
down to a 3.
See?
So
Amazing.
it's crazy how trigeminal neuralgia just gets thrown out there. And I definitely would get, how do you rule one out? If you get some kind of neuromuscular orthotic and your symptoms start to go down, guess what? You rule it out. It's
Mhm.
not trigeminal neuralgia. I
Mhm.
think that is one of the biggest misdiagnosed in the medical field.
Oh, me too. I think so too. And it's with that. And you said TN is often one-sided, but TMD can also be one-sided. So I just wanted to
Correct.
clarify because I may have
Correct.
misspoken.
Correct.
I may have misspoken before. So,
No, you didn't. You were right.
oh, okay, yeah, TMD can be one-sided or it can be both. So again, like you can see that overlap there, and it's really tricky. And um, yeah, I feel like TN is really, really misdiagnosed a lot of the time for, which is very, very. I mean, unfortunate isn't even the right word for that. It just sucks for patients, right? So let's see. How long would you let a patient with disc displacement without reduction go in a repositioning splint that's not working before you try other means to capture the disc? I paid $8,000 to the supposed best TMJ practice in Colorado, and the dentist didn't believe me that my disc was displaced and that my jaw was locked closed. He said it's all muscular and that my jaw is not technically locked. After 2 rounds of Botox and wearing the torture splint 24/7 for 3 months, I went and got an MRI on my own that showed the disc is dislocated forward, as I knew and felt. It's now 5 months since the displacement. I have to go to an oral surgeon to pay $4,000 more to see if he can even get the disc back in place. Whew, that's a loaded question.
Wow.
I know.
Wow. That's a series of unfortunate events.
It is a serious, well, and it's a hard question to answer because the question is really how long would you let it go, right? So a lot of
Yeah.
people come to me with disc displacement without reduction. I think first is just diagnosing it correctly. So I think that was likely misdiagnosed to start
Okay.
with.
So answer according to this guy, how would you have diagnosed it?
So, I diagnose a lot based off of history, symptoms, the palpation exam, the range of motion. I don't require all my patients to get an MRI because
Nor do
one,
I. I never get an MRI.
yeah, I almost never do because one, it's very claustrophobic for people. It's an hour-long procedure and they already can't open their mouth, so they're already feeling claustrophobic. Two, you don't need it to get a diagnosis, in my opinion, to get a correct diagnosis because many people present with the same history. They had a history of clicking and popping, but they could open all the way. Suddenly, the clicking and popping went away. They can't open anymore and they're in a ton of pain. That is the typical history. So it's just
Mhm.
kind of common sense to diagnose it as disc displacement without reduction. Once
Mhm.
you have the diagnosis correct, then you need to do the correct treatment. Now, the tricky part is how long does it take to get unlocked? It can vary. I've had
Mhm.
one patient get unlocked in like a week, and I've had another patient where they had been locked for 2.5 years before they came to see me. And it took us 13 months to get her unlocked and stable in that unlocked position. And
Perseverance.
perseverance, but like, how do you answer, like, did I wait too long? Should I have referred her to an oral surgeon at 4 months? No, because I still got her unlocked. So it's a really hard question to answer. The longer you've been locked, the longer it takes. And then there's other factors that play into like compliance, wearing the orthotic,
Mhm.
hypermobility. That's out of my control. There's
Right.
different factors that play into everything. So I feel like I don't really have a good solid answer to that question. I don't know. I don't know how long to wait before sending him to an oral surgeon. Like if it's been
Yeah.
if it's been a year and or like even if it's been like 6 months and we haven't even increased your range of motion by a millimeter, I refer. But if
Right.
it's been 6 months and we've increased your range of motion to very close to where it was, and the jaw
Yeah.
joint has started clicking and popping again, we're getting all the signs that we're reversing what happened. I keep them on that path of treatment.
Right. One of the things, though, with disc displacement, too, if it's true disc displacement and you just try to open the jaw more manually, if you can't open it, like if I would go and try to move your jaw,
Mhm.
then I know the disc is displaced. If
Yes.
I can
Yes.
move the
Yes.
jaw more, that just means that your body's trying to protect you and the muscles are splinting to hold them close to home because they don't want to work.
Yeah.
So I don't know how he diagnosed it or didn't diagnose it, and that is unfortunate for you. Um, a surgeon to get it back into place. I shy away from surgery. I make a pivot appliance. I think those work fairly quickly to get the disc back on.
Yeah. And I have a certain
But,
type of appliance I make too. And like Dr. Alex said, like if when I ask my patients to open as big as they can, because I need to put a number on their range of motion,
right.
they're opening to like here, right?
Yeah.
I go in and I try to stretch it.
Right.
If I can open them even a little bit more, I know it's probably muscular in nature. But if
Correct.
that doesn't budge, that disc is displaced. So there's ways
Absolutely.
Yeah. And then as we go through treatment, once it starts clicking and popping again, you're reversing what happened. So you're starting to recapture that disc. So there's
Yes.
all these signs. And I ask my patients like a million questions when they come in, um, because I want to know how, like, that it's progressing
What
or that
happened?
this is working.
Yeah, sure, sure. Well, okay. Looks like we're wrapping up this session.
Yes.
So keep
Thanks
the
for all your
questions
questions.
coming.
Yeah.
And we didn't get through all of them, but keep them coming. Refresh them if you need. And we'll do another session like this in the near future.
Woohoo!
So if you want to learn more about this, look at ICMO, look at coming to the meeting, and I hope to meet some new dentists there, and keep questions coming.
Yes. I'm
Thanks.
so excited too. So thanks, guys. And we'll see you all next time.
Bye-bye.